Come on in. I'm Dr. Lyndsi Cress, board-certified family medicine physician and owner of Coral Direct Primary Care. At Coral Direct Primary Care, we focus more on a personal and accessible model of primary care. So I spend about an hour with my patients. I offer same-day, next-day appointments, and we're able to do that by eliminating the middleman of insurance. So my patients pay me a flat monthly membership fee, and they have access to me anytime they need me. They can call me, text me, and message me via email. And that's how we are able to communicate so well and get down to a personal level where we're able to take care of many different health problems and maintenance, as well as preventive measures, and at a personal level. The monthly membership fee is age-based, so children under the age of 18 are $50 a month, adults under 65 are $100 a month, and adults over 65 are $120 a month. And for all that, you get my services. Anything I do in these four walls is included in that flat monthly membership fee. My patients still can use their insurance outside of this office, and so we're able to order things like imaging, referrals to specialists, things like that, and they can still use their insurance at those facilities. It's just my services that are not billable to insurance. So this is Coral Direct Primary Care. I have a small seating area in the front here. I have one exam room, which is in here. This is where we do all of our exams, procedures, all the medical stuff gets done in this room. And then we'll head to my office. So this is my office. This is where most of the visits take place, where we're sitting down together, chatting, getting comfortable, and just talking about our health and all the medical stuff before we get to the exam. Next, I'll show you the lab area. So this is where I process all of the blood draws. I do point of care testing like urinalysis, pregnancy tests. I do strep testing. I even dispense some medications out of the office, and all of that gets done in there. The entire reason I opened this practice was so that I could spend more time with patients. I could get to know them on a more personal level and actually provide the medicine that I was trained to provide in medical school and residency. Working as an employed physician, we're responsible for up to thousands of patients. We're seeing 20 to 25 people a day, sometimes every 10 to 15 minutes. And that's just not enough time to get to know someone. And it's certainly not enough time to deal with 2, 3, 4, 5 medical issues, because no one seems to have just one problem at the doctor's office. So I spend an hour-long visit with patients now, and I'm able to get to know them. And that was the whole reason that I decided to do this. I just couldn't do the 20 to 25 patients a day and go home at night and in my conscience feel good about that, because I knew I wasn't giving the care that I was trained to give. And that just didn't sit well with me anymore. So I opened Coral Direct Primary Care for that reason. And another reason is because of my family, because I wasn't present enough as an employed physician. I was missing practices and ceremonies at school, and I wasn't able to be there the way that I wanted to be. And now I'm able to. I'm present. I'm able to pick them up from school every day. I go to practices. I go to award ceremonies. My family and I, it's just a much better experience having 2 parents there as opposed to 1.5. I'm originally from Buchanan, West Virginia, small town in West Virginia. I did all of my undergrad, my medical school training and residency in West Virginia. I worked for a few years at an FQHC and then decided that we wanted to move south. We wanted to be in the sunshine and near the beach, and we wanted more opportunity for our kids. So moved to North Myrtle Beach in 2019. Worked for one of the larger health systems in the area for about 5 years, and then opened Coral Direct Primary Care in March of 2025. So I always knew I wanted to be in medicine of some kind. I didn't know that being a doctor, or I guess I didn't think that being a doctor was an option for me when I was in college. I just didn't have that confidence and didn't think that it was doable. But my husband, who's one of my biggest cheerleaders, said, why don't you just apply? And so I applied to West Virginia School of Osteopathic Medicine, was accepted, and that was it. I just knew that I wanted to do family medicine from the start, just because I love the relational aspect of family medicine. I love being able to follow a patient over the years and just be with them in every stage of their life. We have a saying in family medicine that we care for patients from cradle to grave, and I love doing that. I love caring for children as well as the elderly. So family medicine was always it for me. And now I'm able to practice in a true fashion of a family medicine doctor, the way that it used to be when family doctors knew their patients and knew their families in their practice. I do house calls. I get to know people. I can go into their homes and see how they live, and it just makes things a little bit more understandable when you know where a patient's coming from and what their home life is like. I think the biggest thing is that relationship aspect of that I have with my patients. I remember as an employed physician having responsibility for 2,000 patients. You don't know who anybody is. They're just a number. And anytime someone would call or send a message, I didn't know who that patient was until I looked at their picture in the chart or looked their last note up and and sometimes even then, I was still not sure who this person was, especially if I hadn't seen them in a long time. Here, as soon as I see a name through my text message, I know exactly who it is, and I know their history, and I know what we talked about the last time in the office, and I don't think you're gonna get that anywhere else in this area, certainly not in the fee-for-service healthcare systems. I think access is so important, especially with kids, and just the peace of mind of knowing that a parent can text me on the evenings or on the weekends just because they're uncertain and they don't have to wait 2 days and that anxiety just build and build until they get to Monday morning when they can actually call an office and may or may not be able to talk to anybody. So I do think that the access portion of what we do here at Coral Direct Primary Care is so important. And one of the biggest feedbacks that I hear from patients is that they just love the access and they love the ability to be able to talk to me directly, and also just having that peace of mind knowing that I'm there and they can call or text if they need me. Just kind of helps people just feel more calm and more at ease with their healthcare. If you're interested in learning more about Coral Direct Primary Care or me, Dr. Lyndsi Cress, please visit my website, coraldpc.com. I'm located at 120 Pinnacle Place, Suite F, right behind the Little River Chamber of Commerce. And I'd love to meet you and talk with you. I also offer free meet and greet sessions if you'd like to come in and see the office and meet with me in person.